Hey everyone, it's Danielle. I just finished my 9th shift as a medical scribe at Mount Sinai South Nassau on a COVID floor. Pretty much the only remaining COVID floor in the hospital. So today I feel like I've been able to reflect a lot on how much I've learned in a very short amount of time. Not just about the people, the patients and the everyone who works here and how the hospital itself works, but about medical management for patients, specifically critical care patients and those specifically with COVID-19. I feel like I was able to participate in rounds today. I feel like I've now learned enough where I am able to assess how much we covered, all the things we need to. For example, we had a new patient come up to the floor today. The patient was recently intubated, and when we intubate, we have them on NPO, or nothing per os, which means nothing by mouth, which means you're not eating, which includes tube feeding, such as a nasogastric tube or an oral gastric tube, basically a tube that either goes in through your nose or in through your mouth and down into your stomach, and that's how we kind of get nutrition for the patient. But when patients are newly intubated, we leave them NPO for 24 hours to sort of adjust, and I realized that this patient didn't have any sort of nutrition plan. So I was able to bring up in rounds, should we give them IV nutrition or dextrose, something to, keep their nutrition up. And the attending was able to make plans accordingly. So I feel like that's, to me, shows how important it is to have multiple people on rounds of multiple disciplines, doctors, nurses, PAs, NPs, respiratory therapists. Having a mix of people from different backgrounds makes sure we cover everything, which is critical in these very ill patients. So I definitely feel like I've gained an appreciation of how quickly you can learn by exposure, and how vital it is to have many minds work together to try to ensure the best outcomes we can.